Good morning, good afternoon, good evening, everyone. Welcome to the virtual talk for this month for the MIT Club of Australia. It's my great pleasure to welcome Becca, and in a minute I will tell you a little bit about her amazing qualifications and career, and she's very nicely given me a bit of a cheat sheet on this slide, which is perfect. But I've known Becca, we're trying to figure it out, more than 20 years because we actually went to high school together in Connecticut. I think she was 1 year ahead of me. And she went to MIT for undergraduate. And then several years later, I think it was 4 or 5 years later, I ended up going to MIT for my PhD. So we just missed each other. But we spent a lot of time together in high school with the outdoor club. I remember going on canoeing trips and hiking trips and things. So we've stayed in touch a bit virtually, but it's wonderful now to connect on her incredible career. Becca, like all of us, is an MIT alum. She has a BS degree in computer science and engineering. And then she also went on to get a master's degree in biomedical engineering. She has had a fantastic career in medtech, and she will tell us more about it today. She spent a good part of her career working for Medtronic and the last year working for Mozarc Medical, and she'll tell us more about that and how that came about. She has a lot of experience in all sorts of trials and technologies and different technical aspects of medtech. So it'll be great to get her different perspectives on her experience. And she also amazingly manages to do things outside of this. So she likes to travel, and she has a wonderful family with 2 beautiful girls who are 7 and 5. So I think that's enough of an introduction. And it is such a pleasure to welcome Becca to give the talk today. So I'll hand it over to her.
Awesome. Thanks so much, Evelyn. And yes, it's been more than 20 years, which is absolutely crazy to think about, but I'm excited to be here. I love talking to folks around the world. I love hearing from you guys and understanding what you're doing as well. I would love to know when you graduated and in what and what you're doing now. Although I know I'll get distracted if you put it in the chat, but in general,
let's do that at the end. Let's do that
at the end. Yes. But I won't cover everything that's on the slide here. Just a few key things as we start. I do absolutely love traveling, and I've figured out how to incorporate it into my job and have been to a ton of places. I realized though, as you guys were talking, I really haven't spent any time going south of the equator. So I'll add that to my to-do list. I've missed everything south of the equator. I think I've covered almost everything north. In general, I love taking on a good challenge, and you'll see this as a trend throughout my slides. I'll walk through my career, both in a little bit of the tech that I've worked on, but also the lessons that I've learned and the types of experiences I've had. And in general, even though I have little takeaways and quotes on each of the slide, takeaways or quotes, my favorite one, which is actually a sticker on the back of my computer right now, is progress, not perfection. And in general, I think it's true about a career, it's true about work. We will never get to the finish line unless we are, or we'll never get to the finish line if we're focused on being perfect. So just making forward progress. And as I did a dry run of this with somebody in my office earlier today, she said that is 100% true. And I'm really good about pulling in ideas and thoughts, from various different parts, and everything kind of being a little bit solid and then saying, okay, here's the direction we're going to go in, and making a decision. So make forward progress. It doesn't have to be perfect. We can adjust later. I am located in Minnesota. It does not look snowy outside today, but this is a view of my street. I do love it when it's beautiful and snowy like that. I think that was just from this past winter. So let's jump in, and I am going to start first. My mouse and my computer are going to cooperate here with me. And of course they're not. There we go. All right, so starting off, I am going to go back to high school because that's where I was first introduced to computer science. And I entered high school. This is a small all-girls school in Connecticut. I entered high school really quiet, shy, not knowing what I wanted to do, and found myself really enjoying the WISE program, the Women in Science and Engineering program. And we had a little room in the basement. We giggled and laughed and learned to code together, and it was absolutely fun. I probably wouldn't have done it if it wasn't fun. And in general, I've tried to keep that trend through my whole career. I like to have fun in whatever I'm doing. If I'm not enjoying it, I'm done and I have to move on. The one of my final projects was actually creating a book. We never got published, but we wrote a book teaching girls how to program. And we had our little character, C plus platypus, because all of the textbooks that we found were boring. And we thought, the team of us who were working on this, that coding should be fun and learning to code should be fun. So we created a book. We had a ton of fun of it. I do attribute my admission to MIT on this book because otherwise, and I'll talk a little bit in the next slide, we probably all had a little bit of imposter syndrome. Like, why was I accepted? Why am I here? Everybody else seems smarter. So I blame the book for that. And as Evelyn said, we spent some time doing the outdoor program when I was there. And the picture here is just rock climbing. We did canoeing, kayaking, rock climbing, spelunking, going inside of caves, camping, so many different things that I think also just kind of helped open me up to new experiences and having fun. A fun part of all of this is that very recently, for the last 3 years, I was actually on the board of trustees for the school. I was able to see the school go into a new transition with a new head of school who is absolutely amazing. I just ended my 3-year term, but it was really exciting to be able to go back and see how they're still encouraging girls to go into into science and engineering, and be able to kind of pull my med tech career back to the school. So
Becca, I'd say for myself as well, even though I went a few years later, that WISE program, that Women in Science and Engineering program, is the reason I was able to go to MIT, because it was really good. And most importantly, it just made me confident enough to want to try.
Love it. Love it. Every school should have it. So from there, I ended up at MIT and got there and said, oh my gosh, what am I doing? Everybody else seems smarter than me. I successfully flunked my first test in every single subject. And it took me a little while to get my groove. And it wasn't until I took a computer science class, not in core 6, I think it was in civil engineering, and it was theoretically an easy one, but I didn't trust myself yet. I was still kind of faking it a little bit, I thought. And I took this class and I aced it. I was like, okay, maybe software is for me. Maybe all of the other things that I was trying out are just not my thing. And pretty soon after that, I got to build some confidence and actually find my space within MIT. So my theme for college here is fake it till you make it, because it took me a little while. I think fake it till you make it is kind of it's building your own confidence. You're usually there for a reason. Other people have had confidence in you. Other people accepted you and hired you, promoted you, whatever it was. But you have to fake it for yourself until you then have confidence to keep going. So a few different meaningful moments here. So my Europe program, so that's the undergrad research opportunity program, was in the media lab. And funny enough, AI is huge right now. And I actually studied it a little bit in college, which 20 years ago is a very different world than Gen AI that we're talking about today. But my Europe program was writing code to have like a musical experience, and it was a neural network that would kind of change as you interacted with the software. And the postdoc that I was working with actually submitted the program as in combination with an architect at the Centre de Pompidou in France. And in my senior year, we went to Paris and pulled all-nighters trying to get this code to work and installed it in this installation in France, which is a crazy thought to me. It seemed normal at the time, but really, really interesting experience. And a very good example too of this postdoc had great confidence that we would just make it work. And I don't know how successful it actually was. Usually if you walk through a museum exhibit, you look around, yep, this is cool. You interact with something, it maybe does what you expect, maybe it doesn't, and then you move on. it probably achieved exactly what he was looking for. I'm pretty sure it got into an infinite loop within 5 minutes. I didn't actually go to visit the experience, but I think that is what I still live with today of like, okay, it worked. We faked it and we made it and it was successful. But it was I'm sure it actually was much better than that, but that was my memory of that experience. Additionally, my favorite class in college was with Professor Patrick Winston, who recently passed away. And he was teaching classes around artificial intelligence. My absolute favorite class was nothing really to do with science, but it was reading different articles and then writing a one-page summary with a different perspective. So you're a reporter reporting on the paper, you're a researcher writing a grant, you're a professor giving a summary to alumni, whatever it was learning how to take the information and convey it to different audiences. So maybe one of my first forays into better public speaking, technical speaking, digesting research papers, not necessarily, they were all related to AI, but it wasn't writing code, it was writing papers. Super interesting. Another maybe another quick example here of something that I thought could have been done a little bit better is I lived in Simmons Hall, and I don't know if you guys have been to campus since Simmons Hall was built. It was finished after my freshman year. It was the first class to move in my sophomore year, and it wasn't finished. It had a huge hype with architects. We had people who came to the dorm all the time. And as a student, I thought they could have asked more students what they wanted. We had cement iceberg things in the hallway, which are great to like roll chairs up and down and also trip over late at night when you're coming home. It was interesting. So I don't know if that quite counts as fake it till you make it. I think it is functional and a wonderful place to live today. Those first few years were very interesting. So again, exposure into systems thought and user experience, what people are thinking when you are building something for them. It's quite a sight. You should actually visit it. So after college, I did go back or did volunteer at the Club of Minnesota. So held events like this and many others. We were more in person than not at the time, and kind of held all the different roles of programming, president, everything in between. And then just a few months ago, very recently completed, I actually just took an AI course from MIT, and it was really fun. They had pictures of MIT. Patrick Winston was there as well, recordings from the past, but they're still providing some really good stuff. And if you're looking for additional education, I strongly encourage you to go back and look at what MIT has online today. All right, so moving right along. My first career fair at MIT, I was walking around, Core 6 major, had software in my pocket, and ran into Google, Amazon, probably not Amazon at the time, Apple, you name it, software companies, and kind of took a step back and said, I don't know what I'm doing. And ended up with a recommendation from buddy, so check out Medtronic. So I ended up interning at Medtronic and then later getting a full-time job. But for those who don't know, Medtronic is one of the largest medical device manufacturers. So engineering, manufacturing, everything in between. They started with pacemakers and they started in Minnesota. And what I learned as soon as I found out about Medtronic is that it was focused on helping patients. The whole mission was all about patients. And for me, I didn't care about making people, be able to search online faster. I didn't care about making websites any better than what they already are. But helping make somebody's life better really meant something to me. So I didn't know that medtech existed. I didn't really know that pacemakers existed, although I later learned that my grandfather had a few Medtronic pacemakers. So I went into this, you really don't know what you don't know, and being open to new opportunities is really important. So in my first job, I worked on download software. So you see the picture of the pacemaker, there's a bunch of code in it. And if you were doing research, there's actually a spot of memory in the pacemaker that you can wirelessly put temporary code into, and it will trigger at certain times when the device is in the patient. They could be walking around, sleeping, whatever the new rule is, the new code will trigger, it'll do its thing, it'll record some data, and then it will go back to normal. And we use this for running research studies. So most of the device is working the same. You don't have to explant something and then put it back in the patient. You just update some code and then remove it at the end. And I worked on that from project management, software development, tools development. I managed some interns. I learned agile software. It's crazy thinking back at this time because those 3 years seemed like forever and I thought I knew everything. And of course I didn't. It was 3 years after college. And at some point, the group reorged. I ended up in a new software group doing similar things, but it really wasn't a personality fit. And I was talking to a friend and they recommended me jumping into systems engineering. And again, I had never really heard of systems engineering. So I didn't know what I didn't know, but I took a leap. And I loved systems engineering. It is the type of discipline where you're taking the big picture, you're taking what the user needs, you're taking what the patient needs, and you're putting it together in thought, design, implementation to actually produce a device that is useful. We work with hardware engineers, software engineers, mechanical engineers, chemical engineers, everybody, and understand the customer and work to figure out the best combination of features that's optimal for everything to do what we need to do. I think the best way it was explained to me is you can have an airplane, and if you have somebody who's focused on making the best wing in the world, great. And then you have somebody else making the best wheel in the world and somebody else making the best engine in the world. If they're not talking to each other in the right dimensions, in the right units, in the right goals, then you will end up with a plane that can't fly. So you need somebody, a function, systems engineering, to pull it all together. It really exists in medical devices, aero, astro, and defense. Those are kind of the main ones where you have complex systems. Within this role, I was able to work on most of the different devices that the cardiac group had. So anything from pure software websites where physicians can look at the data about their patients to actually the predicates of everything that's on the slide. Everything that you see here is market released. When I worked on it, it was early research. And I didn't get it to the market. I usually did the research stuff and then handed it off. But it's really exciting to actually see that most of these exist in the field today. And I started off mostly around the software side, but then eventually branched to focus on implantables and the whole device. So I've supported implant procedures all across the globe, not just country, but globe. I've trained clinicians on new algorithms. I've done animal studies, collecting data, figuring out new electrode positions for cardiac monitoring devices. And towards the end of my time in this group, I was working on leads, which are the wires that go from the pacemaker or defibrillator and into your heart. And that had nothing to do with what I had studied in college. It was fun. I was still problem solving. And eventually I said, I think I've this fit with great systems is great, but now I think I've touched all the products and I'm ready to try something new. And I looked around the company, tried to find who else was doing things that were innovative, and followed a leader who used to be in my cardiac group and had gone over to a ventures group within Medtronic. He is currently the CEO of my company. So I guess we've been working together now for a while. And he basically took a ventures group and turned it into the renal care division of Medtronic. In this group, we were working on dialysis products. So scratch everything I know about cardiac. And of course, I did not have a biomed degree going into this. I got it along the way and finished it just as I started in this group, but it does not tell you what dialysis is. It doesn't tell you about kidney disease. So I got to learn all of that. But my first task as I joined the renal care team was actually to help set up our India office. we had just kicked off a new program, and the leadership team in Minnesota was looking around saying, well, none of us have software experience. How are we going to do this? And I, of course, did have software experience and said, great, I'll go to India once. That's cool. And ended up going every 2 to 3 months for a few years, built up a great relationship with the team there. And I think it really changed my perspective of how I work with teams in general. One of the things that I did very intentionally, and I still do it when I meet new teams or work and go to new sites, taking the time to understand them and coming with an open mind. So when I go to India, I generally am trying to wear a kurti. And the picture you see here is when the team walked up to me and said, well, if you're wearing a kurti, are you willing to wear a sari when we're all wearing saris on Wednesday? I said, sure. And they spent a few hours getting me ready for the day. It was work, but not work, right? It wasn't talking about the product, but it was building a relationship with the team and understanding why they enjoy dressing up in their cultural outfits. Normally, on a day-to-day basis, they're wearing Western clothing, but on Wednesdays and a certain time every month, they decide to wear a cultural outfit together and celebrate. So just showing up and paying attention. A few other things here. So the picture of traffic. I'm sure you guys have heard that there is traffic in India. And when I first experienced traffic, and in this picture, obviously I'm not in the traffic, it really occurred to me that the time that we're having meetings is either when people are trying to get home or when they're trying to not be in traffic, when they're trying to feed their families. And so I started being much more cognizant of asking people what time works for them for meetings. Because if they have a 3-hour commute, our lead software engineer at the time had a 3-hour commute. If it rains, that commute could be 5 hours. He could be staying in the office longer. He could be leaving earlier. And so trying to just communicate and understand where the team is coming from is really important. I also learned this from the CEO at the time of Medtronic, Omar Ishrak, who was an engineer. I believe his degree was in electrical engineering, and he was a really big supporter of the project that I was working on. He had gathered systems engineers together to talk about their views of the company, what's working, what's not, what's cool and innovative, and how do we get the rest of the company to think about the big picture, to think like a system engineer. He also came and talked about the project with us. We had posters, we showed him the device, and he asked really good and technical conversations. He got in the weeds in the project and really cared. And for him to take the time to meet with, us lonely little engineers, I thought was absolutely amazing. Lastly, the sign at the bottom. I think, so this is a sign or a set of signs I saw on some personal travel in India, and it confused me, but then also kind of opened my eyes to trying to interpret the world a different way. I read these words as it's telling me to go 2 directions at the same time, and that doesn't make sense to me. But when I talk to folks in the India office and say, what is this? They're like, yeah, you could go either way. And that conversation has led to a lot more understanding and asking again and rephrasing things in meetings and work, because I understand that everybody can be looking at the same words. We speak English, we are speaking the same language. Native language might be something different, but we can interpret the same words completely differently. So I love this picture. I also loved the site where it was, and I can't remember the name right now, but definitely go travel around India if you can. All right, at some point, I was looking for something different, and within the same department, which is a pretty small group within Medtronic, I ended up switching into a program manager role. And in this role, I ended up playing kind of the role of therapist of a lot of team members. As a program manager, people are coming to you, well, I have to do this, but I can't do that. Here's all of my problems. And it's my job to figure out how to fit the schedule, how to come up with a plan, how to make sure the budget aligns with it. And I actually had a little bit of imposter syndrome here too, and kind of a denial of, I went to MIT and now I'm just managing programs. but they were super complex and they can take a lot out of you. I brought the first neonatal dialysis machine into the US. Its name is Carpediem. We launched it just in the beginning of COVID. And I was a program manager for this project when I was pregnant with my first kid. Take that back. That was my second kid when I was pregnant with my second kid. And to work on a pediatric device when you're pregnant is a crazy concept. And really, I had to dig in and make sure that I was taking care of myself. And if I was taking care of myself, I could focus on getting this product into the market so that we can help patients. And if you do look at some of the articles and videos, there's some good ones out there of customers in the US. It's very touching. To be able to keep babies alive and give them a chance is really meaningful. This is why I do what I do. This was many years ago at this point, but I'm actually still working on this device and helping coach and guide and sponsor that program in a different direction right now. So that's also really fun. Around the same time, I also started up our cybersecurity program. We didn't have anything. Obviously, security is a big deal, and kind of set up our direction within renal care. And that team carries forward today as well. And this is my one picture of my kid in my presentation. I am still working out, yay, still taking care of myself. It is good advice. Take care of yourself. You can only take care of yourself. And I try and set a good example for my kids. So I had a kid come with me to the gym one day and she helped me do squats. I'm pretty sure, lunges. She was pulling my arm down as I was lunging. So it definitely didn't make anything easier. But because of it, take care of myself, I can work hard on the medical devices and take care of my family and get it all done somehow. All right, so fast forward a little bit more. And I took on a larger role. So went from program manager, just bumped up a level to program director, and took on the largest program that my company has. And it's still the largest program, largest in the terms of people and our development budget. And led this team through a crazy deadline. We started to get to a deadline. Somebody said, okay, great, we're going to do this activity. We're going to get to the end. I said, okay, no problem. And it turns out we actually had some major flaws in our scheduling and project planning, and really had to scramble to make this happen. So it was my job to rally the team around how to get this to happen. And I thought about having a slide about rolling up your sleeves, because I definitely rolled up my sleeves. I was a software engineer. I was a systems engineer. I did everything that we needed to get the project done. And this, we bonded as a team. We worked hard together, but it was incredibly hard. And we ended up with some jokes at the end. So you'll see the little blue duck. We named him Doc the Duck, and he came with us on a few different errands. This is our office in Italy, and it was definitely in Italy and on one of our machines, not for this project, but another one. And I think the best way to describe my role at this time is actually in the words of my then 5-year-old. I fix people's kidneys with my computer. That's a great way to say it. So at my computer, I'm driving the world and making things happen. In general, we worked hard and we played hard. When I went back to transition this role to somebody else, I took the time to go to an achataya, which is where they make balsamic vinegar, with some coworkers. And if you're familiar with winemaking and you're familiar with whiskey making, this is kind of a crazy combination of them both. And the product is nothing like you find in the normal stores. So I strongly recommend this experience as well. But as a technology-minded person, this process, how it's so manual, but produces amazing things. It's really, really interesting. My next trip, if it comes, I'm going to go visit where they make Parmesan. That's my plan. All right. So from there, basically at the end of this big milestone, and picture Italy. Evelyn, you were talking about dinners in Brazil going really long. Dinners in Italy also go really long. And every night we were out, and I would come back to the hotel and work and catch up with the US colleagues. And I think it was about midnight one night, and I'm trying to cram things in and get stuff done. And a coworker reaches out to me. And again, this is right before our deadline. And they were announcing that they were leaving Medtronic. And we as a company had also announced that we were moving towards Mozarc Medical. We split off of Medtronic, which is why there's a little dash here. And I was sad that this person, friend, coworker, was leaving and didn't know what I was going to do for the project. Had a great conversation, understood the transition for them, hung up the phone, thought for about 5 seconds, and then called my boss and said, "Hey, I know that you know this and I want that role. I don't know how I'm going to do it. It's the middle of the night. I'm probably being crazy, but I would love a new experience. And I'm still going to meet the deadline, but I'd like to try something new." So she said yes. And, this was a really good transition into a brand new role, where the previous manager was fully supportive of me taking over the role. We were good friends, and it really helped the transition. But I took this on, I embraced something totally new in the middle of a crazy deadline. And while we were transitioning from one company to another, which not everybody was supportive of originally, I think we're all there now, more than a year later. But everything was new. And I realized I'm also the kind of person who goes all in. So not only did I take on a team, but I am now seeing labeling, packaging, and usability everywhere in my life. I can't show you the product stuff here, but the images on the top left are an installation manual from setting up a bike rack. And I did not use any of the instructions because they were horrible and the translations were absolutely horrible. I looked at the final picture and that's how I put it together. It gives me more meaning, the fact that my team does labeling. We create the user manuals for our medical devices. We are in charge of the translations. Most manual that you'll get out of normal consumer goods are absolutely terrible. And I save almost all of them right now. The picture on the right is my vacuum. I started opening my vacuum and thought that the packaging was so cool that I took a cutout and got a screenshot of all of the different layers and the molded fiber and how they merge together a bunch of different material to achieve what they're trying to get to. It's really compact. It protects the product. And I love it. So I'm kind of geeking out on my current role. I'm having fun with the different dynamics. The bottom left, you'll see that Tesla had a recall about font sizes. I'll just use the break one as an example. It was too hard for people to see the small word break. And of course, that exclamation point in a circle kind of looks like all the rest of the images. And people were having accidents because they didn't know what the symbol was meaning. And so they had to make the text bigger. This is all about usability, human factors, UI, UX design, making sure that you're designing for your customer, you're testing it, you're seeing where they make mistakes, and then you're fixing it. So my group now, I'm a manager leading a team, I'm technically user experience director. We support the whole company. We work with all functions. And although I have not individually done each and every one of the things, the functions that report to me, I've interacted with them through my whole career. And when I started this role, it kind of felt like a culmination of everything I've been doing for the past 20 years. And it didn't make sense in the beginning, and it totally makes sense to me now. It also makes sense why all of these things are together, because they interact with each other so much. So I'm still learning. It's really fun. Again, kind of going all in on my current job. So this is where I am now. And I'll end here with a question for you all of what do you want to be when you grow up? And I know I'm not in the last stop in my journey. And I love to ask this question in interviews. And I don't care if it's your final answer. But in general, what's next? What are you looking forward to? What are the things that you like to do? I don't always know what I'm going to do next, but I generally like a challenge. I like to start things from scratch. I love helping patients, and I love working with a fun team. So what do you want to do when you grow up? I'll end there.
Thanks, Becca. That was a fantastic talk. maybe we just have Romain and David here. Maybe they could quickly introduce themselves and say what they did at MIT. And then if they have any questions, it would be great to hear them. So Romain, maybe starting with you, if you just want to
or do you
tell Becca
want
a little
me
bit about.
to answer what do I want to do when I grow up?
Sure, that's a great idea.
I have no idea. But the only thing that I can say is that my wife is pregnant. So my next step and the next thing that I want to do when I grow up is to be a dad.
Cool.
That's a great answer.
I feel that the rest is going to be the rest.
Yep, you will figure it out when you go.
Yeah. There's no manual for that, I'm afraid.
No, there's no manual. Well, there's some books, but it's good to buy the books, but it's better to read the book then. And
when you have a kid, then you'll throw out the books out the window because they're not usually accurate.
Oh, okay. So basically, the person who is a specialist in user manual just tell me to throw the user manual.
I did. Yeah. I think the people who read the manuals the most are the people who work for the company. So when I was supporting research studies, I did write the manuals for the research studies. People would call us asking for a question for help on something, and I would look it up in the manual that I wrote and then tell them the answer. It doesn't have to work that way, but it's a good document and a good reminder. But yes, people very often will throw out a manual. Yep.
It looks like me, yeah.
And Romain, just tell Becca, what did you study at MIT?
So I actually studied supply chain. So
very cool.
Well, originally I did grad school at MIT. So I did my undergrad in France in mechanical engineering, and I worked for like 15 years, and then I did grad school at MIT in supply chain, and I graduated a year ago. So
awesome.
Pretty recent, yeah.
But
I had the chance to work in medical device during my career. I work for Stryker. My wife works for Stryker, and my wife used to work for one of your competitor, Boston Scientific. So this is why there was plenty of pacemaker and different stories that resonate a little bit, in everything that I can know a little bit.
Awesome. Yes, we talk a lot about supply chain. It's really critical. Otherwise, we can't get product to our patients.
Yeah.
And David, do you want to introduce yourself quickly to Becca, and then we can have a bit of discussion and some questions maybe?
Well, it's a bit different from the rest of you. I was in a graduate program in linguistics and graduated from that 44 years ago now. And linguists typically aren't making products and so on. So I just enjoy hearing about a different kind of world from what I'm used to know. Thank you.
That's
awesome.
Great.
I'll say my world has just collided with your world because I'm working on getting a translations vendor for Mozarc as a new company, and translations is all linguists. So
it's depends if it's automatic translation these days. It's computing and statistics, and linguists don't have much to do with it.
Yeah, this is true. This is true. We're not 100% there yet. Depends on the criticality. If it's just a user manual that Roman's going to throw out, then maybe it doesn't matter. But depends on the label, and you want the important critical this product or that product to be translated well. So we still have linguists involved. AI is coming, but not everywhere today.
Right. Okay. Good.
I suppose maybe that's a question, Becca. I'm thinking about user experience. So with AI, and it's getting better and more impressive all the time, but thinking about the translation example, so you could translate the words, but knowing the subtleties of the language and the culture of the language, so knowing how to explain something to get somebody to do something is different. And that's where you probably still do need a person to help advise you on the cultural aspect. I don't think the AI is quite there yet with that.
I don't think it's there 100% yet. And one of the big takeaways from the MIT AI class that I just took is that the sweet spot is humans and computers working together. And I think where that fits within the translations world is you could have AI translate a first pass and then a human go back and make sure that it's appropriate in context. And it could help it go faster, right? You can get more done, but that finishing touch, making sure that it actually means what you want, is important. I am still learning about translations, but also in the context of med device, you generally keep a history and information about how you describe things so that it's common across your products. And we're in the space of dialysis, and so we'll have dictionaries of the right words in the right languages that apply to all of the products. We would say hemodialysis the same way, across any of our products given a certain language. So there's some similarities that you learn there as well. But yeah, AI it's a hot topic right now. And as somebody who studied it in college and as a software engineer, I'm excited about where it's going, but I don't think it can fully take over. Especially today and probably still in the future. There are a lot of errors. They're called hallucinations. And as those hallucinations happen, you need to make sure it's not going to cause a patient safety error, right? You don't want your products to ever end up in a spot where they're not safe for humans. So having a human in the loop is helpful. We talked software in the loop, hardware in the loop, all sorts of other terms around testing. Today, now it's human in the loop. Make sure your AI isn't just going off by itself.
I have a question for you, Becca, just a general question. You talked a little bit about the animal testing. How do you go from the animal testing to the human testing? And I'm thinking especially with something like the neonatal units, because something that I found interesting when I was pregnant with my son is that there aren't as many medications to treat pregnant women as there are for general society. And it's not necessarily that the medications aren't safe for pregnant women, but it's very difficult to conduct studies on pregnant women because there's a lot more controls. So I'd love to hear a little bit more about that, because I imagine that for some types of patients, like the very young children, it can be much more challenging to actually get a product to market than maybe with other demographics.
Yeah, it's a great question. So the general flow of how we develop a product is that we set up requirements, specifications, we design the product, and then we do an awful lot of in-lab testing. So making sure that our product is doing what we want. And that's like literally on a bench in an engineering lab with water or simulators or machines that are moving at a certain rate, bending something back and forth, right? Lots of physical testing, software testing, definitely just simulating what the software is going to do, all sorts of different environments, right? And so we get to a certain point of confidence where we think we've tested everything in a lab environment, and we have to make the jump into a more real life environment. In some cases, it's appropriate to go to animals. That process, though, is very critical and scrutinized. You don't want to just go that direction without really taking into account the humanity of taking care of the animals. So it's not something that every single product goes through. In some cases, it's the only way to show that it's going to be safe for a human before you get to humans. And then the process of going through clinical studies, there's a lot of statistics involved, and depends on what you're trying to show and if there's a predicate product in the field and if you can recruit patients that meet the right characteristics. So I've seen the same thing, and I'm appalled at how little information or how little medications and treatment and data there is for pregnant women, and medications and devices and whatnot for them. It's crazy to me, but it's such a small population, and it's not one that you want to experiment on. If you think about, a lot of times studies will go from a small sample size. So if it's brand new, it might be just dozens. And I'm not an expert in designing clinical studies, but you can have a really small one, and then you can go, into hundreds, thousands, depending on, again, what you're trying to prove. And if you don't have that population represented, then FDA won't necessarily clear you. There's exemptions, there's humane use exemptions, right? If they think this is the best option and we can't get enough data, in some cases things are released, but that gets tricky, and we're taking on the risk of releasing something without all of the data that you need. I'll translate that back actually into diversity in medical devices. And a lot of the clinical studies don't necessarily have diverse populations. And so the data may only be accurate for the populations that you studied. In kidney disease, I think a good example is the eGFR. It's the measurement that shows the health of your kidneys. And that measurement was wrong for people of color compared to white people, and was being used incorrectly and wouldn't trigger that somebody of color was sick when they were, because of how the equations were written and how the studies were done. So you have to make sure you have enough data and that you're getting a good enough representation of the population, in order for your data to make sense and your devices to do what they need to do.
That's great.
Yeah.
Romain,
So
do you have any questions? Sorry, go ahead.
Yeah, so maybe like speaking about on the medical device point of view, one thing that I always found a bit frustrating is like the time. Like we spoke about, like the development, you just spoke about the test, the regulation, the compliance, and at the end of the day, the talk with the cardiac surgeon, which is probably not also an easy part. How long were like your different projects, and finally did you manage to see them, from end to end?
Good question. I've seen every part of a project. And it depends on what you consider to be a project. So so one of the algorithms that I worked on in the cardiac space, I worked upfront from requirements definition. What are we doing? All through the testing, back and forth arguments with software of how it's going to work, train the clinicians, reviewed adverse events for the study, and then provided input to the implementation team who is going to take it from a clinical study into a permanent device, into a fully released device. I wasn't part of the development process for the final device, but I saw that project end to end from idea. So it's a brand new product that isn't proven in the market and has to go through research, many years. I think the product, the very, very, very first software algorithm that I worked on in 2005 went through probably 3 or 4 clinical studies, and eventually ended up in a product, I think, trying to remember when it was released, more than 10 years later, at least, if not more. And the product that I had the major deadline for, the work hard, play hard, that one has been more than 10 years as well. And it depends on the technology, right? If you know what you're building and you're just creating another generation, you can do it in 18 months. If you don't have to do a big clinical study, right? If you don't have to do huge amounts of testing, if you don't have to do research in order to prove what you're trying to build. So, and that 18 months probably doesn't include getting the supply chain set up and the product into the market once you have approval. It usually doesn't include the approval cycle, right? So it's a long time. You have to have a lot of patience if you're going to follow a product all the way through. And I've had a lot of fun switching projects, and through my switching projects, supporting everything in every different phase.
I have another question for you, Becca. Have you had much exposure to the business case or how you motivate for this? I mean, to put the funding in to develop a medical product for 10 years takes a lot of money, I imagine.
Yes.
And I don't know very much about this space or developing pharmaceuticals, but you sometimes read stories about how it can be challenging to get medical devices for rarer diseases because it's difficult to make money with that. So is that something that you're able to comment on a bit about how you look at the business case and what do you choose? Because there's probably many more illnesses to treat than you have the capacity to actually build a device for.
Right. Yeah. I'm not usually the one generating the business case, but have supported the business case generation many times. And in my current role, I'm on the R&D leadership team. And so we're always looking at where we're spending our money and what projects we're supporting, what's higher priority than something else, and making recommendations to other functions, convincing them to do something or not. And I think there's so many different things that play into it. The neonatal device, for example, it's a really small market, but there's a huge need. And not too many companies have something out there because it takes a lot to do that development. And because you're not selling 1 million devices a year, the business case is different. And I think that there's so many different aspects of it. If you take, trying to think of a really good simple example. I'm going to flunk right now.
That's
but
okay.
if you take anything that you see, it is getting late. If you see anything in your normal life, right, you can make it expensive, you can make it cheap. There's also different levels of quality, right? And so how you're sourcing the materials, how you're putting it together, how you're building up infrastructure or not, right? If something is low volumes, you might have a less automated system. If something is really high volumes, the more you automate it, the cheaper it can be to actually manufacture. So putting together the business case has to take in the patients. What are people going to pay for it? How often are they going to, is it a disposable or a piece of capital equipment that you sell once and then use for 10 years? Plus, how many different countries are you selling it in? How are you servicing it? There's so many different aspects that it is hard. And I think maybe a lesson that we probably all learned in college as well, I hope, failing fast is important, right? And once you know that there's an issue or that assumptions have changed or that the market changed, right? Then having the guts to go back and revisit your decisions is really important, and not waiting, not taking years to change your mind. I think that's a
challenge in many companies. It's certainly a challenge in some of the projects that I've worked on.
Yeah, Netflix is a great example. Sorry, Netflix and Blockbuster, right? So Blockbuster never changed their business model, and they went down with selling videos or renting videos in a box store, right? Like you had to go into a Blockbuster, rent your video, and then take it home and return it, right? They never changed. Netflix came in and they did change. Redbox also kind of like it came and went, right? So you can look at different examples in any part of your life, right? Where is Motorola today? Where are, like, name a different company that's no longer there. And did they come along with the times? Did they make good decisions, or did they stick with the technology that they were going to do before? Where is BlackBerry? Right? Like so many different examples. So making those decisions and changing and pivoting as you have information, I think is really important.
Speaking about business, why would Mozarc Medical be a separate entity from Medtronic rather than being part of Medtronic? Well, what's the logic there? What's in there for you?
Yeah, and I didn't touch on it too much, although this takes up and has taken up a lot of my life in the last 3 years, planning, negotiating, splitting out of Medtronic. So within Medtronic, renal care was a really small business, and Medtronic is set up for a lot of global efficiencies. And I think there's a ton of benefit to being a part of a company like that. But as such a small player, the rules, the systems, the processes that we had were not set up for us. The incentives for how our sales team was selling in the field didn't financially benefit our organization. And it doesn't mean it was bad, like for patients, nobody was doing anything wrong, but it didn't put us in a spot where we as a small business or as a small organization within the company would be successful. So we left Medtronic as a joint venture between Medtronic and DaVita. They both thought that the company was a good idea, but needed to go off on its own. DaVita is a large dialysis provider, and between the two of them, they're both now on our board and driving the direction of the company, and helping figure out where we should be going and how to prioritize. And so now we can focus on dialysis. We've narrowed down on our portfolio. We've narrowed down on geographies so that we can be more successful. And instead of trying to do 100,000 things like you generally do within Medtronic, it's narrowing down and focusing.
That's great.
For me, it's an adventure. It's fun. It's different. We'll see where it goes. Being part of a smaller company, you have lots of dots of different hats that you wear.
Yeah. We'll be in touch, Becca. I'd love to see what you do in 3 years and in 5 years and in 10 years.
Me too. Yes.
It was great. Awesome. I think we'll leave the talk there. Thank you so much. I'm going to stop the recording now. If you want to hang on for just a minute, Becca, that would be great.
Yeah, thank you.